treatment approach for soft tissue injury, how it's been evolved over the years. We're going to look into that. Hello everyone, welcome to another episode of Ask Giri the Physio Show. Today's topic, effective management of soft tissue injury, how it's been transformed over the years. That's what we're going to look into. You all might know about RICE, R-I-C-E, rest, ice, compression, elevation. So that's what we started with quite a while ago. Then from there we came to PRICE, P-R-I-S-C-E. P we added to the RICE, which is protection. So protection, ice, compression, elevation. We kind of rolled over with some time with that. Then from there we moved on to police. What does police mean? P for protection, OL for optimal loading. Kind of we brought loading into the picture there because we all know how important loading is for soft tissue management. That's where physiotherapists come in to create the dosage for your rehab. So P for prevention, OL for optimal loading, ICE, you know that already, ice, compression, elevation. So we kind of rolled around with police for a while, but finally now we arrived at peace and love. We're going to see what is peace and love and why it is the current effective soft tissue management criteria for healing. It may be ankle sprain or knee sprain or shoulder sprain. We are following this peace and love. Let's talk about peace and love. What peace stands for is again protection. When you are injured, whether it's an ankle sprain from your soccer injury or a shoulder injury from a throwing athlete, right? So you're going to avoid activities, give little bit of a rest in the time for the tissues to heal. Every tissue has a different healing time. You need to have some patience. I know when you're involved in sports, that is very hard to come by. We all want to jump in and play right away after injury, but you have to listen to your healthcare practitioner to kind of take a little break so that the tissue can heal. Then if it is a lot of swelling, you can elevate it a little bit when you're with your pillow or a sling, whatever you want. Then the A in peace stands for avoiding anti-inflammatories. It's a very common thing when you're injured. If you go see a doctor, you're going to get two things: pain medication or painkillers and anti-inflammatories. So you have to understand inflammation is a stage 1 of healing. Healing starts with inflammation. So if you're going to pump in way too much anti-inflammatories, you're going to spoil that first stage of healing, which is inflammation. Too much inflammation, too much pain, yes, you can take a pill or two here and there according to your doctor's advice, but taking so many anti-inflammatories, it's not going to work towards your good healing process. So avoid anti-inflammatories as much as possible and also take other pain management ideas from your healthcare practitioners to manage your pain. That's a very important thing. This we added in the peace and love. This is A for avoid anti-inflammatories. C again for compression. Compression can come from your bandages, your tapes, and also we have intermittent pneumatic compression devices in our clinic where we see like a lot of swelling is there. We put that big long sleeves in your upper limb, lower limb, and your trunk to work on a compression techniques. This intermittent pneumatic compression devices give you this very pneumatic waveform compressions to take care of your swelling. But if you can't access your physiotherapist with intermittent compression device, you can always use a lot of other techniques like bandages and taping and things like that. That's the C in peace. And the E in peace is education. You should know that why rest is important, what are the stages of recovery, and how the pain can be managed. And you also should be educated about pain neuroscience because pain neuroscience have evolved so much. If you haven't watched our previous episode, go to physioshow.ca or Ask Giri Physio Show YouTube link and watch Pain 101 and a lot of pain neuroscience education modules we have created before. And I want you to educate yourself about how the pain is. Pain is just a feeling, it's an output, right? You don't have to have tissue injury to have pain. So it depends on so many factors like your emotions, your past experiences, your behavior, your socioeconomic status, your work stress, your family stress, your sports team stress, your coach stress, training stress, missing the game stress. There's so many things play into the pain. It's just more than your ankle ligament. So I just want you to understand that. So educate yourself, avoid a lot of unnecessary passive treatments and medical investigations, and let the natural healing process occur in your body and you enhance the healing process, okay? Not all sprains and strains need an X-ray, ultrasound and MRI, okay? Very rarely we need radiological investigation for soft tissue injuries. Like if we have a doubt that you might have a fracture, we'll definitely refer you for X-ray, rule that out. Otherwise, most of the soft tissue injuries can be diagnosed clinically, and effective treatment strategies can be started from day one. So consult your physiotherapist or your healthcare practitioners to start that right away, your active treatments. So that's your P's. Like we covered the P's now. I'll repeat one more time. P for protection, E for elevation, A, avoid anti-inflammatories as much as possible, C, compression, E for education. Now we are moving on to the love. What does L stands for? Of course, loading. Optimal loading is very, very important, right? Like make sure that your gradual return to sport happens from gradual loading process guided by your healthcare practitioner. And that's our cup of tea. We know how much to load, when to load, how to load, and load management. Maybe your lifestyle factors or the sports training, how much load your tissue can handle and how to progress that. We'll take care of that. Optimism. I want you guys to be positive about your injury. Don't get dwelled by fear. If you're seeing a lot of people and creating a lot of fear into that, oh, you will be on the wheelchair. You cannot play for 6 months. You're done for life. You will never be able to play again. These kind of negative inputs, just stay away from all those things, okay? Stay positive, stay optimal, consult your healthcare practitioners and to get back into your sports as soon as possible and with great optimism. Vascularization, that's the V in the love. Vascularization is how to increase the blood supply to the area. So for that, you have to do a lot of cardiovascular activities that increases the blood flow to your repairing tissues or the healing tissues. And again, your physiotherapist can dose that and create that based on the injury and the stages of the injury and what kind of sport you're going to and what is your role and what your sports demands and life demands of that injured tissue and you as a person. So the last but not the least is E. E stands for exercise, right? You have to restore your mobility, your strength, your joint position sense, which is called proprioception, your agility, stamina, endurance, so many things after injury, right? And all these things can be approached by active exercise program, which is specifically individualized treatment plan created by your therapist for you. That is why you can't just go to YouTube and grab a couple exercises and do that to get better. It has to be individualized based on your condition, your needs, your goals, your sport, your life, and you. So I'll summarize the love again. L for load, O for optimism, V for vascularization, E for exercise. And that's the peace and love from me to you to manage your soft tissue injury effectively. So if you like this presentation, please share with your friends and family, and please also like, subscribe and share the YouTube channel Ask Giri Physio Show, and that will be great benefit for others as well. A big thank you to the 6,000 subscribers for our Ask Giri Physio Show YouTube channel. It's growing slowly. It's not about the numbers. Even if I have 1 subscriber, I'll be still doing my videos every month to educate and empower, which is my purpose of physiotherapy life. Right? That's exactly what I want to do. And thank you so much for everyone who subscribed and spreading the good word among your friends and family for their musculoskeletal health, pain-free life and happiness. Thank you.